Miscarriage is a pregnancy loss that happens within the first 20 weeks of gestation. It is a common experience, affecting about 10 to 20% of known pregnancies. Most miscarriages occur during the first trimester, before 12 weeks of pregnancy. Miscarriage can be a physically and emotionally challenging experience for women and their families. The symptoms of a miscarriage can vary, but often include vaginal bleeding, abdominal cramping, and the passage of tissue. It is important to remember that miscarriage is rarely anyone's fault. Most often, it is caused by chromosomal abnormalities in the developing baby, which are beyond the control of the mother. If you think you might be experiencing a miscarriage, it is essential to contact your healthcare provider immediately for guidance and support. Chromosomal abnormalities in the developing baby are the most common cause of miscarriage, accounting for about 50 to 70% of cases. These abnormalities occur by chance and are not typically related to the mother's health. Other factors that can contribute to miscarriage include maternal age over 35, hormonal imbalances, uterine abnormalities, chronic illnesses in the mother, infections, and exposure to certain environmental toxins. It's important to note that many miscarriages have no identifiable cause. Maintaining a healthy diet is crucial during pregnancy for both the mother's and baby's well-being. Safe foods include fruits and vegetables, aiming for a variety of colorful produce, whole grains such as brown rice, quinoa, and whole wheat bread, lean protein including fish, poultry, beans, and lentils, and dairy products, choosing low-fat or fat-free options. Unsafe foods to avoid are raw or undercooked meat, poultry, and seafood, as these can harbor harmful bacteria. Unpasteurized dairy products, which may contain bacteria that can cause infections, high mercury fish like shark, swordfish, king mackerel, and tilefish, and alcohol, which is best avoided entirely during pregnancy. Staying active is generally safe and beneficial during pregnancy, but certain activities should be avoided. Safe activities include walking, which is a low-impact exercise that is safe throughout pregnancy, swimming, which provides a full-body workout with minimal stress on joints, and prenatal yoga, which helps improve flexibility, strength, and balance. Activities to avoid are contact sports due to the risk of injury to the abdomen, activities with a high risk of falling such as skiing, horseback riding, and gymnastics, scuba diving, which can cause decompression sickness in the fetus, and hot tubs and saunas, as prolonged exposure to high temperatures can be harmful. While most miscarriages are not preventable, there are steps you can take to promote a healthy pregnancy. Take a prenatal vitamin. Ensure you're getting enough folic acid, which is crucial for fetal development. Manage stress. Engage in relaxation techniques like yoga, meditation, or deep breathing exercises. Get enough sleep. Maintain a healthy weight. Avoid smoking and exposure to secondhand smoke. Limit caffeine intake. If you experience any of the following symptoms during pregnancy, contact your healthcare provider immediately. Vaginal bleeding or spotting, severe abdominal cramping, fever, chills, foul-smelling vaginal discharge. Medical treatment for miscarriage depends on the type of miscarriage and the individual woman's circumstances. In some cases, expectant management may be recommended, which involves allowing the body to naturally expel the pregnancy tissue. Other options include medications. Medications can be prescribed to help the uterus expel the pregnancy tissue. Surgical procedures. In some cases, a surgical procedure called a dilation and curettage, or D&C, may be performed to remove the pregnancy tissue from the uterus. Your healthcare provider will discuss the best treatment options with you based on your specific situation. Miscarriage is a common pregnancy complication, but it can be a very difficult and emotionally challenging experience. It's important to allow yourself time to grieve the loss and seek support from loved ones, support groups, or a therapist. Remember that you are not alone and there is no right or wrong way to cope with a miscarriage.